This week, Dr. Kevin returns to the Dog Lovers Show to meet some fascinating people involved with our canine favourites. Our trainer Chris calls in to see our chocolate Labrador Strider at home with his family. But first, Dr. Kevin talks to us about the importance of regular health checks for our senior pets.
Today on Pets Practice we're going to talk about our senior pets and how best to look after them. Dogs and cats age about 7 times faster than us. And what that means is if you're only taking your dog or cat to see the vet once a year, it's like us going to the doctor once every 7 years. Dogs and cats are considered senior once they reach about 8 or 9, but in fact some giant or large breed dogs are considered senior once they reach about 5 years of age. Now once they go over into that senior category, things unfortunately do start changing. We're about to meet Diesel, an older dog that's been suffering from arthritis for a number of years now. We're going to talk to his owner Sue about his case. So let's go meet Sue and Diesel now. Hi Sue, how are you today?
Good, thanks Dr. Kevin.
How's our patient going?
Look, he's not too bad, a little bit slow, the cooler mornings, but he's okay.
How old is he now?
13 and a half.
Wow, hey, you are getting on, aren't you, mate?
Yeah.
He's certainly looking very well.
Yeah, I think so. Walk every day, so...
Yeah, excellent.
Yeah.
So how long has it been now that we've been managing his arthritis?
Oh, it feels like for years.
Yeah,
but,
it's certainly been a number of years.
It's been a while, yeah.
And you certainly have kind of all the bases covered for him, don't we?
Yes,
so
yeah.
He has lost a lot of weight, which is great.
Yes, well, you put him on that bit of a diet plan, so we've been following that, so he doesn't get all the munchies in between anymore.
Yep, and that waistline is quite prominent now, which is really, really good.
You can see it, can't you? Yeah.
So that must be helping a lot in regard to his mobility. What's his mobility like at the moment?
Very good. I mean, he sleeps a lot, but, you know, as I said, we walk half an hour every morning and he keeps up and he's off lead, on lead or whatever, so he's fantastic. He's still very good. Yeah.
Good. In regards to his pain management at the moment, I know that in the winter months as we're coming, as they're steadily approaching, those mornings are going to be a little bit harder for him. He's on pain management now every day?
Yeah, he has the tramadol tablets morning and night.
Yes.
So, and that's definitely made a huge difference.
Excellent.
Definitely.
Good. I suppose, Sue, at this age, the most important thing is that we keep him comfortable.
Yes, as long as he's happy.
Yeah, exactly. Now, he's also due for that injection of his, isn't he?
Yes.
So, the Cartrophin injection, the Pentazan injection, is a little bit like motor oil for a car.
Right.
So it just keeps those joints lubricated.
Yep.
It's really the only thing that we've got in our arsenal, I suppose, so to speak, to help slow the progress of it down. So I know that he's now getting that on a monthly basis.
Yes, I get the reminder notices every month we come in.
And do you notice a difference when he has those injections?
Well, it definitely helps him through the winter months, heaps more. I mean, the summer he's fine, he's running around, but the winter, I definitely notice that it's helped him a lot.
And going back a number of years, I know we first came to see each other after him having some mobility issues with his back legs, particularly after him suffering some cruciate ligament injuries.
Yeah, that's right.
Since him starting on kind of the arthritis treatment management, what sort of improvement did you see?
I don't think he's limping as much, and when he gets up, he seems to get up like in one go, whereas before it would be just very slowly, so especially on the left side. So there was some obvious discomfort and just we started off with those injections and then over the years as he's aged, obviously arthritis is not something that we can get rid of. No. It's something we manage. We've kind of implemented some other things along the way. He's now on the tramadol pain relief. And do you give him anything like glucosamine? He has the glucosamine fish oil tablets.
Excellent.
For adults. 3 a day.
Excellent. What does he think of those?
Well, as long as I give it to him on cream cheese, he's good. But if I give it to him on its own, it's like, no way. But the cream cheese seems to work, so that's his treat.
Not great for his waistline, but as long as we get the
only a little bit.
Excellent. So I'll get that injection organised.
Okay,
I certainly think that he's checking out really well. I think that it's important now that as we are approaching the winter months that we do, you know, keep in communication and making sure we are continually doing what we're doing. But the fact that, you know, he's moving around as much as he is, the fact that you're continuing that low impact exercise is obviously keeping him happy. And that's the most important thing at his age, isn't it? Hey? Good boy, Diesel. Do you want to live a treat? Hi Laura, how are you today?
Oh, I'm good, Dr. Kevin. We're doing really well.
Yeah, nice to see you.
Hey.
Hey, hi Mo, nice to see you too. Her coat's looking amazing.
Oh, isn't it? She's put on a bit of weight too, I think.
Yeah, she's really turned around since we first diagnosed her with her thyroid condition about 12 months ago.
Oh, yeah.
She?
I think she was only down to about 2 kilos then.
Yeah, no, you're exactly right. I checked my records before she came in and she was 2.05 kilos. Let's pop her on the scales now and see what she's weighing in at. Good girl.
Oh, you're such a good girl. There you go.
Wow.
You're joking.
3.6 kilos. That's fantastic. She looks amazing.
Yeah, well, she loves her tucker.
So, how old is she now?
Well, 15 in June.
Wow, don't tell her that.
No.
She's looking really good.
Well, she gets her tablets in the morning. She
Yep.
gets her tablets at night. She has her blood pressure tablet in the morning as well.
Yep.
Bit of mince to start
Excellent.
it off with. Oh, we have to really fool her into eating it. But other than that, she's great. As long as I can get her tablet in, I'm happy.
Yeah, excellent. Well, let's have a listen to her ticker, and then what we'll do is it's time for her blood pressure check as well.
Excellent.
That heart murmur's disappeared as well, Laura.
Excellent, excellent.
So, with thyroid disease, her elevated thyroid hormone was increasing her metabolic rate.
Yeah.
You brought her in because she was rake thin, but her appetite was still
Enormous.
ravenous.
Yeah.
What that thyroid hormone was doing, it was just increasing her metabolic rate. Everything she was eating was just getting churned through, and she wasn't able to maintain any weight at all.
Makes sense.
Since being on that neomercazole, that's reduced her thyroid levels. Her heart murmur has actually reduced.
Yeah.
Last time we saw each other, we did end up diagnosing her with high blood pressure as well.
Yes.
Which is just another one of those conditions that unfortunately our senior cats can develop.
Yeah.
Let's get the blood pressure unit on her, and hopefully that Norvasc, given to her once a day, is hitting the spot.
Absolutely.
And then we'll just take about 3 or 4 readings, Laura. And
Okay.
take the average between. Yeah. Her blood pressure's sat consistently now over 190.
Yeah.
What we preferably like to see it is under about 170.
Okay.
In a veterinary hospital situation, if it's about 175, I'm not too concerned.
Yeah.
But certainly 190. Anything over 200 certainly puts pressure and risk on their eyes. So let's have a look at those now. But we may in fact need to increase that Norvasc dose. These actually are looking pretty good, but I certainly think the safest thing to do, Laura, is to increase that dose just marginally
Okay.
to protect those retinas.
Let's practice. Let's practice.
We're at the home of the Sandersons to see how they're all getting on with Strider, the newest member of this growing family.
So we're at home here with Steph and Strider, just finished up at puppy school, still full of beans.
Yep.
How you been going with him?
Yeah, good. He's getting on well. Been a bit of a big change. Having him, but getting on well. He's learning lots.
That's great. Not too heavy for you?
No, not yet.
That's good.
Give him a few months.
Okay, practice for the baby. I was strengthening up the arms already.
Yep.
Okay, so how's he doing at home? Is there anything you need to work on? Is there anything that's worrying you? Are there any particular skills you need to teach him?
I suppose the main issues that we have with him involve sort of integration with children in the family and refereeing and making sure that he's not aggravating them and they're not aggravating him. So that can be a bit of a juggling act at times. Particularly outside, keeping him a bit under control because he does things like gets into Aiden's sandpit and wrecks his sandcastles and that sort of thing, and that doesn't necessarily go down particularly well. So working out that sort of stuff. Yeah.
Okay, so with the kids, so you're saying like make sand castles over there, and he comes in and bowls them over.
Yeah, he likes digging in the sandpit.
Like sticking in the sandpit. That's pretty normal.
Yeah.
So what have you done around that so far?
I have tied him up at times so that he's not
Tethered?
able to get into the sandpit while we're building castles.
Yeah.
Or put him back in the dog yard where he's separate.
Yeah.
If I'm actually in the sandpit building a sandcastle with Aiden, I can sort of just hold him out with one hand and build with the other.
Yeah.
So that kind of works.
Okay. I said, that's fine. So what we'll do is start off with, So if we've got his mat as well, we can use his mat so he's got a comfortable place to lie down rather than the cold bricks.
Yep.
We can also use some treats. We'll keep him on the lead so that way we can block him from entering the sandpit.
Yep.
And he gets rewarded every time he's staying outside of the sandpit. If he goes inside, then obviously we'll give him a little bit of a pop, a little bit of a correction to let him know that's unacceptable.
Yep.
Are you fine with that?
Yep.
All right, great. Let's get started.
All right.
Okay. So we have Strider on his mat now, as you can see. So what we're trying to do to start off with is not create too much distraction for him. So keep him back at a nice distance. And then what we'll do is we'll slowly start creeping forward. So I'm going to do is give him quite a bit of rewards while he's on his mat here, just to calm him down a little bit so he understands he can still get rewards without having to get rewards from the sandpit in that sort of sense.
Yep.
So it's going to keep him on his mat for a little bit. So normally would he be what triggers him jumping in the sandpit? Is he normally trying to get in now, or?
Yeah, just with the fact that we're in here and wanting to help and dig too.
So this is a lot better than normal?
Yes.
Yeah, so obviously, so keeping him distracted as well can help.
Yep.
And so slowly, if we start slowly creeping forward, we can teach a little bit of impulse. Yep. So what I want to do is, I don't want him to get off the mat on his own terms. So I'm going to release him every now and again and bring him back. So, okay, free. Good boy. Now what I'll do is this time, sit. I'll move the mat just a little bit closer.
Let's make a pond.
On your mat.
Make a pond, or would you dig some holes we can fill that
Good.
with water later?
So the second he gets on his mat, give him a bit of a reward. Come on, all the way on there. Good. Nice puppy.
Can you help dig out the edges? Go grab the green shovel and we'll dig out the edges.
Good.
Right, bring it here.
What else I like as well, I like to give them chews while they're on here too. So obviously chew takes quite a bit longer than a liver treat. And also it does have a calming effect on a lot of dogs as well.
Found a boat, yeah.
Good
Yep,
puppy.
that makes sense. We've got some roost sticks in there that'll
Good puppy.
work well for that.
Good puppy. Good.
How many things?
I am
So
helping
keep
me
it here
dig.
like
Look at
this.
that. Oh, look, I found a ball. Can you help me dig, Aiden?
Do you want to do lots of digging? Good. So I'm going to do, I'm going to release the puppy again now.
Dig. Good boy.
Okay, Strider free.
Digging.
Good. I'll move the mat a little bit closer now. Good, sit. Good boy.
We'll make a waterfall, okay? Let's
Sit.
keep digging.
Good puppy.
You can put some water in here when we're done.
Huh?
You can put
Good.
some water in here when we're done.
You can see we're getting pretty close now with the mat.
Yep.
Okay, on your mat. Good puppy. Good puppy. Good. Nicely
Sticks
done.
falling over, are they? That's no good.
Good. Good puppy. So right now he's doing really good.
He's doing a great job.
So I'm really happy with this. I wasn't expecting it to be this easy. Good.
Aiden, when Strider's on his mat, we leave him alone.
Good puppy.
Come.
Good.
Put the shovel,
That's good.
put the shovel back in the sand pit because we don't
That's good.
bother Strider when he's on his mat. We leave him alone.
So I'll do is, do you mind if, good puppy. Good. Do you mind if we switch places for a little bit now?
Yep.
I'll start doing some digging. I haven't dug in a sandpit for a very long time. All around here?
Get all the way around the edges.
Okay. So do you feel confident in being able to implement this while I'm not here? More
Yeah.
importantly?
Yeah.
Great.
I
So-
mean, I'll probably have to use the post to help me out.
Yeah, like I said, use it to your advantage. Like you can tie it up. You've got two different tethering spots right there.
Yeah.
And I said if you give him a chew or something like that to start off with, that way you don't have to constantly give him treats. He has a chance to relax a little bit more. But this is really great. I'll be happy with this.
Yeah, he's doing well.
So we'll end it on a high note, give him a bit of a pat, and we'll finish up.
Good boy. Okay. Good dog.
This will be
Very
more
good.
fun. Let's practice.
So we can. Quick little. Hey, and up. Yeah. So every time he starts to act inappropriately, you start grabbing hold of the collar and it leaks too much. And if you don't like that behaviour, that's all I'm doing right now. Just step in, quick little clap, my hand saying enough, and guide him back into a sit. As soon as he calms down, I'll say free and let him play again. So we have to do quite a bit of this at the start. Then after a while, the dog soon understands that when he says enough, playtime's over. Yep. So just keep him, let him play again, get a little bit excited. Got a nice pull to it. You don't want to play with your auntie anymore.
Enough.
Perfect. You see you had a good response there straight away?
Yep.
Let's make him sit.
Sit. Strider. Sit.
Good now.
Good boy.
As soon as you're ready, release him.
Free.
Might have to drop down. Free. Get a little bit more of encouragement. Good. So get him excited again and let him play.
Good girl. Good girl. Ready? 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 Go. Enough.
Good.
Sit.
Sit. Let's go into a sit.
Sit. Good boy.
Good boy. Nice. So I think we'll end it there. That was a real good positive note.
Yep.
So, do you understand? Can you implement this moving forward?
Yep. Yeah. So it's just instantaneously.
Yeah, it's a quick little interrupter.
Yep.
So the dog understands that behaviour stops playing altogether. Yep. When you're calm and relaxed, you're not biting too much, and you can keep on playing. The second you cross a boundary, it's a quick interrupt, plays over.
Yep.
Until they calm down and then let them go again.
Right.
Yeah, that's it.
So, Steph, what was it like when you first brought Strider home? Did you have to do anything differently with your family?
We did. We had to make sure he had an area of his own where he could go away from the kids. So he's got a pen and a crate set up inside where he has his space so that the kids are leaving him alone. We also had to make sure that he knows that he's not allowed to jump up on the couch when I'm holding the kids. Often of an evening time, once the kids have gone to bed, then he'll sit up on the couch with me. But during the day, when I've got the kids up there with me, he's not allowed to be on the couch, and he knows that. So yeah, he's had to learn a fair bit. He's had to learn how to walk beside the pram, because most of his, well, in the morning I take him out for a walk with Arwen and there's no kids around then, but during the day if he goes for a walk it's always with the pram, so he's had to learn not to get in the way of the wheels.
Good girl. Good girl.
That's practice. That's practice.
Marie, could you tell me a little bit about what Slade Compoundier do?
So it's all about compounding, so we can make tailor-made medications for the patient.
Yes.
So it can be a combination of different drugs,
Yep.
or a strand that doesn't exist in an existing proprietary product.
Yes.
But it's also flavoring or making the drug into a more palatable
Yeah.
form. A tablet is not always the best way to give medication to an animal, so we can make it in a nice chicken or in a nice liver treat
Yeah.
or a nice tasty paste.
Absolutely. I know from my own patients that I look after at Vets on Parker, we use compounding pharmacists more and more.
Yes.
Got a couple of cats we use that formulate medication into a paste that we can put on the inside of their ear.
Exactly.
Because some owners really struggle giving medication to cats, and some cats can be very difficult getting the medication into. That sort of stuff that Slade Compounding works on too?
Exactly, so that's what we do every day, and we're happy to work with the vet and
Yes.
with the owner
Yes.
to find the best solution for the pet, but for the owner as well. 'Cause
Yes.
as you said, sometimes the owner who's not comfortable giving medication, and
Yes.
so
Yeah.
it's just making life easier for everybody,
Yeah.
and for the vet as well, because you know that your patient gets the right medication in the right amount, which
Correct.
is very important.
Yeah, compliance is a big issue. So Marie, if an owner is interested in formulating their pet's medication into a tasty chew, a liver flavoured paste, or the paste on the inside of the ear, how do they go about doing that?
Okay, they have to talk to their vet.
Yes.
It's always, the vet is the one deciding what medication they need
Yes.
and how it's going to be delivered. So the
Yep.
best way is when your vet is about to prescribe you something,
Yeah.
don't hesitate to ask questions.
Yeah.
And what is it? Is it a capsule? Because
Yeah.
I dread the time when I have to give a
Yeah.
capsule. So talk to your vet.
Yeah.
Your vet will know what form is suitable,
Yep.
if they can match different drugs into the what form.
Yep.
And talk to you about what's the best flavor.
Yeah.
Would chicken work better? And
Yeah.
but
Or cheese?
exactly, or cheese, or fake chocolate, or
Oh, wow.
we can get really creative and inventive. We have all sorts of different flavors
Yes.
of work. So yeah,
Oh, fantastic! I know this sort of company, the compounding, is certainly making the delivery drugs a whole lot more effective, and for that reason, pets are living longer and happier lives. So
exactly,
yeah,
that's
good
the
job.
idea. Yeah,
Thanks,
you.
thanks, Marie.
Thank you. It was a pleasure.
Carrie and Di, could you tell me a little bit about Australian Working Dog Rescue?
Certainly. We started rescuing working breeds back in the start of 2010. Cattle dogs, kelpies, border collies, woolies and mixes of those breeds because there was a real need for it. So many end up in pounds on death row needing new homes.
So how does your company work?
Our organisation
Yep.
is a non-profit animal welfare charity. We operate by getting the dog out of the pound, getting it into a foster home, getting it fully vetted including desexing,
Yep.
rehabilitating it where needed and finding it a new home.
So you rely solely on kind of a broad foster care network?
That's right. We don't have a shelter per se. We just use foster care network and volunteers.
Mm-hmm. And if someone wanted to get involved, how would they, if they wanted to become a foster carer, how would they go about doing that?
They just visit our website, which is workingdogrescue.com.au, and fill out a form.
Excellent. And who have we got here?
This is Nimble.
Nimble, she's lovely.
She's 6 months old tomorrow.
And could you tell me a little bit about Nimble, her story?
Certainly, Kerry can tell you that.
Nimble's actually a rescue from Harvey Bay in the Queensland area. She came from a litter of 8 that was surrendered to us, which was one of those accidental litters that tend to happen, and rather than being sent off to the pound, we sometimes step in before that and take them off hands before they get the chance to get there and rehome them. This one we fell in love with, and she's going to be a future demo dog for the organisation.
Excellent, well she's lovely. Hi Nimble, good girl. Well, it sounds like you're both doing an amazing job. Congratulations.
Thank you.
Sandy, as a vet in suburban Melbourne, more and more I'm getting asked for advice in regards to how people can transport their pets either domestically whilst they're on holiday or they're moving, as well as clients who are moving overseas. You own Jet Pets. How does Jet Pets facilitate that sort of movement?
The role we provide, Kev, is basically the same as a travel agent. Book the flights, arrange containers, ensure that pets travel safely and comfortably and enjoy their trip.
Fantastic. Now, if someone has the need to move interstate or internationally, where would they go to find extra information? How long do they have to take to kind of plan the move?
I think it's really important that people plan early. The pets themselves, it's fantastic if we can get time to facilitate them to get used to the containers that they're travelling in, and create acclimatisation is probably one of the key elements to making it a good trip. So that type of information is what we provide as part of our service.
Now Sandy, a question that I get asked a lot is when people are taking their pet, just say up to Queensland for a holiday, they often ask about, is there something that you can give me to keep my dog quiet or sedate my dog whilst they're travelling? What's Jet Pet's philosophy on that?
What we generally say is that if we can get one sedative tablet, we break it in half, and the owner takes that half and throws the other half in the bin, because really, it's like taking your dog in the car. You're not going to sedate your dog to take it on a car ride. It's really, sedation can actually have adverse effects when dogs go into atmosphere. So it's really important that, unless it's a specific case, that dogs will travel much better with good crate acclimatisation. Perhaps a rug or a blanket with a familiar smell is much better than taking some sort of sedative.
Yep, excellent. Sandy, you've been a wealth of information. Thank you. I know a lot of people will be taking that sort of information on board. So yeah, thanks for your time.
No worries. Nice to meet you. Cheers. Okay.
Pauline, you're a trustee of the Australian Anthrozoology Foundation. Could you tell me a little bit about that foundation?
I could. So anthrozoology just really means human-animal.
Yes.
So anthro is human, zoo is animal.
Yes.
And we're really interested in human-animal relations, and I'm a psychologist, and I work at La Trobe University studying human-animal relationships.
So what sort of research do you want to start developing, or do you want to start performing?
Yep. So we do things like the benefits that people get in nursing homes when animals go to visit them. So we have animal visiting programs, and we want to document and measure how that helps people. And there's some research with children learning to read, having a dog with them, particularly children with reading problems, learn to read better when they've got a dog with them. Children with autistic spectrum disorders, there's some research around showing that dogs are really helpful for those children. So those sort of things, we're interested in documenting that. But also just, normal people with normal pets, they get out walking more, and we know that walking is important. They meet more people, so they get social benefits.
So documenting the health benefits of pet ownership as well.
Yeah, and we think that they're really important.
Absolutely, it certainly sounds like a very important field of research, and something that's only going to develop more as animals are becoming such a more important part of our lives.